Jen from Reform Physical Therapy in Pilates in downtown Cleveland. This week we've been talking about labral tears, and it's Therapeutic Thursday, so we're going to go through a couple of the special tests we use in therapy to determine if someone has a SLAP lesion, which is a superior labral tear. There are different kinds. This test just for that. There are several tests that are sort of the standard that have been used over many, many years, the O'Brien test and the active compression test, but the sensitivity and specificity of those tests have sort of shown that they're not the greatest because a labral tear often has some concomitant issues going on. You could have a rotator cuff tear or some stuff going on with your bicep tendon, your supraspinatus tendon. So oftentimes those tests don't really show exactly what's going on. So there are a couple newer tests, not exactly new, but newer tests that I'm going to show you today. The first one is a pronated load SLAP test. And what you do is you take the person's arm, this is Celeste, and she has a lot of rotation, she has a lot of motion in her arm. So you take her out to about 90 degrees of abduction, and I'll drop her all the way back into external rotation. Her maximum is quite a bit. And then I'm going to take her into a fully pronated position, and what I want her to do is she's going to resist an isometric contraction of her bicep, and if that was painful, this would be positive. If she had pain in her shoulder, that would be a positive test for a SLAP lesion. The other test is the resisted supination external rotation SLAP test. So it's almost the same setup. You start down at their side, you take them into about 90 degrees of abduction. This one isn't quite as much elbow flexion, so you're not quite at that 90-90, you're more around 60 or 70 degrees of elbow flexion. I take her back in this like neutral alignment of her forearm. I take her back into her maximum rotation, and now she's going to resist into supination, so I'm going to resist her. She's going to try and turn her arm over. Again, if that's painful, that is a positive for a SLAP lesion. All right, so those are just a couple newer tests. They do have a higher sensitivity and specificity when it comes to when compared to the other tests for looking at a SLAP lesion. All right, thanks so much.